For patients that are missing teeth, it's always great to have options, and a bridge and an implant are both viable options. An implant in dentistry is one of the most long-term and predictable clinical outcomes that we can have, or clinical treatments that we can deliver. The short-term investment in cost or the short-term investment in time will pay dividends because an implant is much more long-term and predictable. The upfront financial obligation for a patient that is pursuing an implant may offset what it would take to do a bridge. Yet down the road, the benefits are going to be reaped because an implant is going to last significantly longer. It's more predictable, it's more long-term. We can control the outcome more fluently with an implant. And the bridge, there's more obstacles or more burdens with doing a bridge because you are relying on the integrity and the health of those surrounding adjacent teeth. In my opinion, I think the upfront commitment or time and financial obligation to get through that with an implant is going to have many benefits down the road.